Chelsea Cutler with Love to Buy You. Welcome back. It is the Country Viewpoint here on your colour of Country Life, Flow FM. Well, we've spent some time this week focusing on the state of healthcare in the regions, and it's time now to go to Susi Tegen. She's the Alliance Chief Executive Officer of the National Rural Health Alliance, and she joins me now to talk more about the recent incentives for rural generalists, which is being welcomed by her peak body to improve the workforce out in rural and regional Australia. Susi, lovely to have you with us. How are you?
Hi, Alice. Well, thank you.
Excellent. Well, before we get into the nitty-gritty, I just wanted to quickly focus in on your background. So you do hail from our broadcast areas. Just tell us a bit more about your upbringing and how it came to be that you are now in the position that you're in a prominent space in the medical field in Australia.
Yes, so I worked and lived for more than 30 years in rural, remote and regional Australia, and spent a considerable time of that working in the southeast of South Australia. So I'm really passionate about that region in particular because it has wonderful industries. We were on the farm, wonderful environment to bring up children, but also to work. And, the economic benefit and contribution from the region, from farming, from agriculture, aquaculture, forestry, and other industries is, nothing to sneeze at. And great rainfall, wonderful wine, beautiful beaches. What else could you want?
I think you've absolutely hit the nail on the head there, and that'll be absolutely music to the ears of many of our listeners who do hail from that area and are listening to us right now from that area for that matter. Just tell us more about what the essence of the advanced skills are which people need to be up to speed with when it comes to working in rural and regional Australia. Presumably, as soon as you come out of studying at university in a capital city, you're not quite there yet, and you do need to do some learning on the job, if you like. So tell us more about what it actually encompasses when you say that, advanced skills are needed for people to work in rural and regional Australia. Obviously, so many complex issues that do provide barriers and challenges for young doctors who want to sort of start their careers in the regions?
Well, I'll just go one step backwards and just say that if we recruit students or school students that have been to primary school and secondary school in rural areas and have grown up there, and then they do, they study medicine, which has a rural component, exponentially, they're more likely to go back to rural communities, which is fantastic. So we need to do more of that. But then once they come to the country, once they finish their undergraduate medical degree and then they've done their training scheme, so let's say they've done their rural generalist or general practice training scheme, let's say they go to the country, and then often rural generalists specialise in so many other areas as well, because often they are one of the very few doctors servicing communities. And so they often might do emergency medicine skills, they might have skills in obstetric and gynecology, they might have skills in mental health that a general GP that might work in the city doesn't, necessarily have or nor need to have, because they can refer to other specialists or other clinicians that are able to support them. And so we really need to support those doctors that work in the country that have to have broader and deeper skills, because there's nobody else to help them often. And so with this incentive payment that the government has recently released, it's an extension of something that, of grants that had been given in the past, but now really specialises on rural advanced skills. And they are things like incentive payments for emergency medicine upskilling, between $4,000 and $10,500 per annum for doctors providing a level of emergency care and emergency after-hours service. And then they can also do the advanced skills, which is advanced skills such as obstetrics, anaesthetics, mental health, First Nations health, and surgery. And it's really important that rural doctors are supported to do this.
Susi Tegen joining us. We'll rejoin her right after this. Stay tuned. Ed Sheeran and Luke Combs with the song Life Goes On. And welcome back. It's the Country Viewpoint second hour on Flow FM. I'm currently speaking with the CEO of the National Rural Health Alliance, Susi Tegen. Susi, I just wonder, will this be enough to entice, certain doctors with certain profiles from the city to go out to the regions? It's all good and well trying to ensure that those who study medicine from regional Australia eventually do come back. But for those who, let's say, are in the city and, they're in a committed relationship and probably aren't quite ready to be confronted by the realities of what working in the regions can present, is this amount of money per annum enough to entice a number of people in that category to go out and give the regions a go?
You raise a very important question because, as I mentioned before, it really is only one component of what is needed to support the future doctor workforce. The whole value chain, and people in agriculture understand this. You need to understand the whole value chain of food to the consumer. And it's the same goes for the value chain of what it takes to become a clinician, from school all the way to the end of their career. And the government has worked on a few initiatives and reviewed, some of the strategies that we currently have, including Medicare. But Medicare was never meant to be a total payment for a service. And so we need to make sure that if there is an expectation of bulk billing, that there is support in other ways to actually cover the cost of delivering a service and making sure that people that deliver healthcare and medical care in rural communities are supported in many other areas, not just a workforce incentive. That's one component. Does it mean that people are more willing to go to regions? Yes, it helps people believe that they will be supported when they come to the regions, but it needs to be a whole suite of different initiatives. And the existing workforce needs to be supported as well. You can't just keep supporting people that are new. You need to support those people that are already there, who have been delivering care and have been very loyal to communities, to service them and to be part of the community, to be part of the local football club and the local services clubs. And so we just need to make sure that the government understands that the contribution of that 30% of the population is significant, that their health care and well-being needs to be taken in consideration, despite the fact that they're not in the city. They are Australians and they deserve the same health care. And the same goes for those doctors that either work or wish to work in those regions. And, it'll be very interesting to see what the government will do in the upcoming budget, but also leading into the election, because rural Australia is hurting. They're not only dealing with droughts, with fires, with floods, with global markets, but they're dealing with worse health care outcomes. And yet, our tourism income is considerable because people love going to the country. We also know that during COVID and post-COVID, people continue to move to regional Australia. And so communities are vibrant and they are active and proactive and they're informed. And so we need to make sure that we work with our communities to communicate with government and to continue to grow and stay vibrant.
National Rural Health Alliance Chief Executive Susi Tegen joining me on the line today to discuss a range of different issues as well as the latest incentives to improve the regional workforce. Susi, very appreciative of your insights. We'll have to chat to you again real soon. Good luck with everything going forward. Thanks for your time.
Thanks, Alice. Thanks for your time.
Susi Tegen is the National Rural Health Alliance CEO, telling us all about the latest government incentives to get more doctors out into the regions. Big third hour coming up on the Country Viewpoint, so do not switch over. Back soon.